tooth doesn't walk into your office by itself. It comes connected to a child, or it comes connected to an individual.
Oral health is a primary care issue. So when I was trained as a PA 15 years ago, I learned that the oral exam involves all of the pink and red stuff in the mouth, the muscular thing in the middle of the tongue, and then where it really gets interesting is where the tonsils are and all of that stuff. But the shiny white things, we can not worry about those because that's really the purview of dentists.
When I say untreated decay among American Indian kids, I'm not talking about a little cavity here and a little cavity there. I'm talking about kids who are at the age of 3 have nearly every tooth in their mouth decayed, sometimes down to the gum line, where more than half of the population of kids has to go to the operating room to be treated.
And it was interesting that it sort of stood out as a little orange state in a sea of blue. And I was wondering, from your experience or just knowledge, could you provide some context to why Massachusetts seems to be an outlier?
All right, so what brought you to this session today?
Well, I'm actually doing a feature about oral cancer in Massachusetts, and it's related to chewing tobacco. But also I have a personal interest because my father is actually a dentist in Georgia, and so we actually talk about these things all the time. So I thought that it would be an interesting way to inform not only a feature that I'm working on, but also, you know, get a greater context to an issue that we don't cover a lot. And in Massachusetts, I rarely read about oral health disparities or screenings or issues that we're facing. So this was really informative, and I definitely walked away with a couple story ideas. So.
Okay, cool.